Clinical feature of pulmonary TB. Patient comes with a cough more than 2 weeks, fever, hemoptysis, blood in sputum, weight loss. In this diagram, we can see the large cavity over the apex of the lung, and the patient come with all these features. So, in this we can learn that there is a cough, fever, hemoptysis, and weight loss during the pulmonary infection, and it causes TB. So, come with another slide that is called Pulmonary TB mainly affects lungs and its parenchyma. Most common cause is Mycobacterium tuberculosis. Mode of infection is through droplet nuclei. Transmission of droplet nuclei is from 1.5 micrometer from infected person is through coughing, sneezing, laughing, all airborne transmission. Development of disease mainly depends on the individual's cell-mediated or innate immunity. Now, in this diagram, we can see the Mycobacterium tuberculosis is bacilli is entered in the nostrils through inhalation, and it then goes into the lungs and causes TB lesion at the base of the lung. In 90 to 95% of infected individuals, it is spread through hematogenous route, that is blood route. Mycobacterium tuberculosis DNA detected in tissues is in situ PCR. In 5 to 10% of infected individual, it progresses to cavitary TB. There is also a reactivation of TB, for example, after immunosuppression, HIV infection, or smoking. Cavities open into the bronchi allow spread of Mycobacterium tuberculosis through coughing. In this, there is a risk factor which causes the pulmonary TB, which increases the occurrence of pulmonary TB. There is a low socioeconomic status, elderly and infants, crowded living condition, alcoholism, and weak immune system are the major risk factor for occurrence of pulmonary TB. So, in primary pulmonary TB, inhaled tubercle bacilli are engulfed by alveolar macrophages in which they replicate to form a lesion called gone focus. It is frequently found in the lower lobe or lower part of the upper lobe. Some bacilli are transported to the higher lymph nodes. The gone focus together with the enlarged lymph nodes is called the primary complex. So this is the features of primary pulmonary TB. In both this diagram, there is a lymph node component below the bronchi and lymphatic component and gone focus. In this, there is a gone focus and lymph node together called gone complex, which is subpleural and found in the lower lobes. Secondary or post-primary TB. It is caused by the reactivation of the primary lesion, that is endogenous, or by exogenous reinfection. Reactivation of TB is likely to occur in immunocompromised individual. Granulomas of the secondary TB most often occur in the apex of lung. In this, we can see there is endogenous reactivation and exogenous infection. In endogenous reactivation, the tubercular bacilli from Gons focus travel upward to the apex of lung and consolidates there and causes apical consolidation. And it also travel to the exogenous route through the lungs. So there is two types of reaction, that is endogenous reactivation and exogenous infection in the lungs in the secondary TB. In non-cavitary lesion, it causes non-cavitary lesion or cavitary lesion in both the lobes of the lung. Presence of caseous necrosis and cavities are two special features of secondary TB. Cavities may rupture into blood vessels, spreading mycobacteria throughout the body.